Hello, and thank you for attending our webinar on COVID-19 and really meant to be a roundtable for the public sector. And really excited about having you here. Hope that you and your families and your employees are healthy and safe. NEOGOV's excited to try to bring you what we think is a unique experience in that we service like 100 million people in the country. And in many cases, we've got some hotspot areas clearly ahead of what the rest of the country is going to see. And so we reached out to them mainly because we felt like they could add to what experiences you guys are going through in the marketplace and in the agencies, as well as what may come. And so if you don't know who I am, I'm Shane Evangelist. I am the CEO at NEOGOV. And we'll moderate the call the best I can. Let me first apologize. I've got a couple of kids in the house. My wife's here. We've got 2 dogs. So you may hear some things in the background. And so, I think probably all of us are in similar situations like that. So thanks for your patience with that. And so I'm going to check here. I think Libby, are the slides moving forward? I see the COVID-19 slide. There we go. That's me. We can keep moving on. Thanks. We're gonna record the webinar so that if people haven't been able to listen, they'll be able to come back in later and hear that, and then ask questions as we go throughout it. We'll leave 15 minutes to the end to answer questions and some hopefully get some responses back to people who got questions in the marketplace. Thanks. So I think generally we keep hearing from HR professionals hit hardest. There's a bunch of work from home issues, a lot of focus on health and safety, a lot of focus on policy changes, just in general, just not prepared for what's come. And so we put together this panel of folks from some of the hardest hit areas. Typically you've heard California, you've heard Washington, you've heard New York, all represented on the call today. And I think we've got a slide on that, Libby. Yeah, so effectively you'll see where this is from the CDC this morning. And so you can obviously see the red areas and the real red areas. And so this is who we've got on the call. And hopefully the intent here is to allow these folks to talk a little bit about their experiences, and then hopefully folks that don't have quite the same numbers yet can hear about what they wish they would have known and some of the challenges they face. Maybe the rest of the country can get a little bit ahead of it in some of these agencies you guys are operating in today. So we're going to hear from the areas around the hardest hit. We're going to see what's happening from a workplace standpoint that you guys are dealing with, the challenges of agencies in general, and then tips that you guys might want to throw out there. So let me start the introductions. First, I think from Los Angeles, we've got Pam and Roseanne, both superstars in that department, people we've enjoyed working with. We really appreciate you guys joining the call. Then we have some folks in from King County, Michael and Julie. Thank you for getting on. You guys have been great customers as well, and always willing to jump in. Michael, we're going to head out there to the East Coast, I think now, and from Nassau County, certainly probably the hottest spot you've seen right now in the country is in New York. Then I think Sheree from Santa Clara is also joined us, and also then we have Mitzi in from one of our tribes who is in the middle of it up there in Mason County, Washington. And I think that's everybody, correct? Yeah, perfect. And Sheree, we just talked about. So let's start with this. Pam, maybe I'll start with you in Los Angeles County. Kind of give us a feel for what's happening there. and kind of the general feeling that's going on in LA County right now.
Sure, Shane. I think like probably everywhere, it's strange. It's a very strange time. In terms of what's going on the ground, I think yesterday as of noon, we had around 536 cases, and we have experienced 7 deaths. The cases are increasing as we speak. We're currently under what we call a safer at home order, and have been I think since Friday. Which means really non-essential retail businesses are all closed. Of course, the county's still working. All of our employees are still working hard. But what it means is that both the county, actually the state and the city, are encouraging people to stay home if they don't have to be out during this time.
And maybe Julie or Michael from King County, what's going on up there as a state for citizens?
Yeah, so we're, I think we've been maybe hit the longest. I think the first confirmed case was up here in Everett, Washington. Our state is at 2,200 cases, I think, as of yesterday, and 110 deaths. King County, where Julie and I work, has been kind of the hardest hit county in that area. We have 1,170 of those cases and 87 of the deaths. I think a semi-large chunk of those have been attributed to one life care center. I think 35 of them. So that's pretty tragic. We've kind of had an escalating stay-at-home direction happening. Most of the King County got sent home that first week of March, so this is our 4th week working from home. And most of our big employers in the state, like Amazon and Microsoft, Facebook, Starbucks, also sent people home at that same time. So most people are working from home at this time, except for essential services. That includes a lot of our employees, bus drivers, nurses, medical professionals that are all still in the field. Just yesterday, we put an official stay-at-home order in place. So similarly to what's going on over there, all non-essential businesses are closed. There's some pretty strict definitions about what that looks like. Parks are closed.
Was that the governor put that in place for Washington as well?
The governor put that in place. Yeah. So we had it kind of happening piecemeal in cities and counties, and then yesterday it got put in place for the state. So that's kind of our spot.
And Michael, in Nassau County, can you fill us in on what's happening in that part of the country?
It's kind of similar to what's going on in Los Angeles and in Washington, where the governor has issued only essential offices are open, police and supermarkets, liquor stores. But in terms of the county employment, it was kind of like the gentleman from Washington said, it was kind of incremental. At first, it was only essential people at work, then groups of 10, and then last Wednesday, we were given the order that's the last day in the office, and everybody was leave. There would be no more working at the office, so everybody is working at home, but it's not broad-based, at least in my office, which is the Civil Service Commission. It's only like the supervisor level people who have access through VPNs or laptops. So it's really, the rest are getting paid on like a paid furlough, but it's really a skeleton crew. I don't know what's going on in the other county departments, but in terms of the Civil Service Commission, maybe there are like 10 to 12 people working online out of an office of 50. So it's, even though it's online, it's still very limited.
Mm-hmm. Yeah, that's going to be a good lead into the workplace issues we're dealing with here in a minute. Let's move over to Sheree in Santa Clara County. I guess California, similar situation for you there?
Yes, as of yesterday, Santa Clara County has 321 cases. 116 of those are hospitalized. We've had 13 deaths. So we started with the shelter-in-place order. Our governor has expanded it to the rest of the county, so now everybody is shelter-in-place. There's still certain things open, grocery stores, gas gas station type things, and they're able to have restaurants if you don't eat inside, so they can drive through or pick it up, but there's nothing inside and everybody's 6 feet apart.
And then Mitzi, up there, tell me about what's going on with the tribe and you know, how you guys are handling it.
So, hi, I am the IT director and communications section chief, and we're having some, sorry, I have someone else in my ear. We are doing okay health-wise. We are locking down our community as much as possible. Our clinic medical person had us send people home that were in that high risk list, so that was good. And several of my staff have been home. This is going on their 4th week, but they have been slammed with helping over 100 people be able to work from home. And so take care of your IT department. If anything I would have done differently, would have been setting up training those people. And we have about 16 departments. We also support our not just our clinic, but our businesses. And I would have stole our IT people from our other entities sooner so they could be online to help people that are just not used to working in an virtual environment. And some of the programs we've used, we were just learning them. We'd switched over our ticket system and different things like that. Some of the communication pieces, trying to do internal communications and external communication to communities and other entities. I think we've been doing okay with that. And then a couple of days ago, a neighboring tribe clinic closed, so we're looking at bringing them and folding them under us. And it's just that the speed of change has changed daily. So I've been working every day since the 2nd, and I have a team of 7, and they've been doing amazing. They're all tired. And the departments that weren't really being told to be sent home are now coming to us and asking. So we're out of laptops. We even bought extra, so we're starting to steal things from different labs and things like that. So on those side of keeping people connected and working as well as possible in that communication piece. So there's a lot going on, and I think we'll be fine. We have great people in place to set up for making sure we have shelter. And one of our bosses is military background, so he's been really great and trying to think and prepare for the future if and when. We have elders that we're really trying to protect, and some are in the hospital for other reasons, and we're trying to really educate our community and do those things to keep ours as protected as possible for as long as possible.
Yeah, thanks, Mitzi. We realize you're under the gun right now. I got a lot going on, so we appreciate your comments. Pam, what's the biggest issue you're dealing with at LA County from a workforce perspective? Kind of what's the state of the state there on that?
Yeah. So one of the things, I think the one thing in human resources, from a human resources perspective, we have since around July, we've really been focused on increasing telework amongst our staff. Started as a project to reduce emissions and just make work-life balance for those people. I'm sure you've all heard stories of LA traffic. So it started as that. We steadily increased the number of people from DHR who could work maybe 1 or 2 days at home via telework. I'm really glad that we had that 6-month run up to this because I think one of the things we did right was early on in the emergency, before the safer at home orders, before you start hearing all the federal telework we got together as an HR exec team and said, listen, we need to put our people out now. We don't want our human resource staff to be ill. We're going to need to be a powerhouse workforce during this crisis to help all of our employees. We have 111,000 employees that we serve. And so we made a decision, I think, early on to put our folks out on telework. Nearly 97% of our HR department of 500 went on telework. I think it's hard to know how long, maybe last Monday, I think it was last Monday. So kind of early on in the crisis. That was one thing that went right for us. Not a lot of issues. Our CIO could probably speak to that more effectively, but we did not have maybe one or two problems with connectivity. So that went seamlessly. And in turn, then we felt like we could really help the rest of our departments as they go through putting their folks on telework. For the most part, all of our, what I would say, non-emergency responders are on telework if they can be. We do have a certain amount of staff in every single department that just need to be on the ground to maintain the business because the business of the county continues to go on.
Can I ask a question about that? Was the county just ready with the hardware to move everybody out, or like how did you do it? We've heard from many agencies that they just simply can't work from home because they don't have the technology either from a hardware or a software perspective. How was LA County in a position to do that?
In DHR, we were ready. We had most of our staff telework over the last 6 months to attempt it. So we had most of everything ready to go. The county, not so much. We do have some departments who are struggling. And there are some departments who are saying you need to access remotely and you may only have access to your emails for a while. Maybe you're using your own laptop. So they're kind of modifying, and our county employees are pitching in and saying, yes, I can, absolutely. So not everybody, we knew that there was a tiered approach. Not everybody would have access to full systems immediately, but if they could get on through My PC or through Office 365 just to get their emails, to be able to respond to their emails, that was great. A lot of folks don't have company issued cell phones. So a lot of folks are using their own cell phone for call centers, for call forwarding, just ensuring that that's happening during this first couple of weeks of the crisis. We have we have around 500 staff in DHR, and we have a mix. We have some staff who have full VPN access if they need it, our execs, of course, or some people who need access to systems. But we're modifying that approach at DHR as well to say, if you only need access to email, we're going to put you out and put you only on email right now, just to keep everybody healthy. And we have a lot of folks who are still working on site in an emergency center.
What percent, Pam, do you think of the county's workforce is still working on site?
Yeah, I would say a good 60% is still out in some capacity. They're working in a hospital, or they're working in a clinic, or they're on site. We have deployed our disaster service workers plan. And so we're putting people, maybe you were a secretary 2 weeks ago and you are now out assisting in a homeless shelter. So we're mobilizing that throughout the.
So a lot of redeployment of resources as well.
A lot of redeployment. Yeah, a lot of redeployment of resources. And that part is unique for us. LA County, we're very skilled unfortunately, we're very skilled in emergency situations if it's an earthquake or most recently the fires. And in those times, some of our employees can be impacted based on where they live or where we're experiencing it. That is the unique thing for us here is, I think, the challenge of knowing that at any given time, any employee could be impacted from this or their family could. So it's somebody just said it's changing rapidly, minute by minute, dynamic situation, who's working where. That's the part that I feel if I were to do this all over again, I would, and we've said this, we now see the need for a skills database. A live, very up-to-date database of every single person we employ, all of our 111,000 employees and their skill sets.
Yeah, interesting. Yeah. How about Michael or Julie in King County, sort of big workforce issues there you guys are dealing with?
I would echo Pam. I mean that, and I won't go all into it because I think Pam covered it pretty well. Really think about what telecommuting is going to look like for people, because pretty much everybody who can is being asked to do it. At the county, we're lucky that we are kind of set up we're all set up. We don't have desktop computers. We're all set up with laptops, people who are working in the office. So it's easy to take that stuff home. And I think most people have access to VPN stuff, but we are also asking people to use their phones if they make calls. And so it's a very similar situation there. Some of the other things, like we're also looking at reassigning people. So like people who can't telecommute, we've set up like classifications, like special classifications for them to like volunteer to serve in other capacities, whether it's some of the hotspot locations we're setting up or whatnot. That has been something we put in place. So we have that going on. Looking at my notes here. One other thing that I'd suggest you think about is what does it look like for people who can't telecommute and can't do other assignments. So we put in place some paid leave situations. So we have a donated leave program we've set up for people who are affected by COVID-19. Employees can donate leave, and people who are affected by it can take that. Our executive has also made the decision to, I think similar to, Michael in New York was saying, to kind of paid furlough people who can't telecommute and who don't have, who've already used their leave. So think about what pay is going to look like for your workers, for people who can't telecommute and who aren't required to be, on the ground doing work. That's something I'd suggest you think about as well. Some of the other things we've done kind of quickly is set up, some kind of analytics around like what absenteeism is looking like. So there's, a fear that all of our employees are going to get sick. I don't think we've seen that yet. And I think that's maybe been calming in a way to see that that's the case. I think there's a lot of numbers being thrown around on the news every day, and it's easy to think that means everybody's sick. It's not the case, but we do have to take it seriously. So getting a sense of like what your workforce is looking like on an absentee base would be helpful to have that ready to go. And then the other kind of big gap we've had is figuring out how to decide what's essential and non-essential and just our day-to-day stuff. So like we're still doing a lot of hiring for those temporary positions for like medical professionals or custodial jobs, people who need to keep things clean. And we have to figure out a way to do our normal stuff for them in a non-normal way. So in King County, we've done new employee orientations in person forever. It's Monday every week. So we're having to quickly find a way to put that either online or kind of reassign who's doing that. And that's been a challenge for us. So shout out to NEOGOV for letting us take a look at the onboarding module. I just saw before the call that it got turned on, so I can start figuring out what it's going to look like, because our work isn't shut down. I mean, when we're saying we're working from home, we're still working. So we're just trying to find a way to figure out what's most important and how do we automate or put online some of the things we're used to doing in person.
Yeah, it's hard to onboard remotely, right? When you're typically done it in waves or in masses. How many people, the number, are working from home, do you think, in King County right now?
It's probably similar to what's going on in LA County. I mean, from the HR perspective, it's around like 98%. It's very high. But our workforce, like a large percentage of our workforce are bus drivers, are people who take out garbage, people who work in the jails. So that ends up meaning something like 60%, probably similarly to what's going on down in LA, are people who are still in the office. So we're trying to figure out, how do we keep them safe and make sure we have like PPE available for people who need it. And we're facing the same struggles that everybody else is facing in the country, figuring out how do we get that stuff. So,
Michael, in Nassau County, what do you kind of same issue? What are your big workforce issues you're dealing with?
Okay, just to let you know, my department doesn't like the broad powers that these other agencies seem to have. In other words, the county executive's office and human resources, they're the one who set the policy about the workforce and who's to be hired. What we do mostly is examinations. We qualify people. So our use of NEOGOV is not onboarding. It's strictly through Insight. And the challenges that we're facing in my department, which is all I can really speak to, is that we have examinations scheduled throughout the spring. So we had to work in conjunction with New York State Civil Service because they're the ones who provide us the examination material, and we had to communicate to them to see if they were going to postpone exams or not, and they really didn't give us very clear information, so we had to kind of postpone exams on our own. And the issue is, if you are an agency who gives exams, you have to look forward and see what your contingency plans are. You're not able to test when you could test in the future, which really nobody knows. It makes it difficult. An issue we had is we contract school districts to use their buildings. And what we're finding is a lot of these school boards don't want us there, and I don't know how long it's going to be. I don't know if we're going to have any control over when we can, whether it's going to be June, July, or fall. So I think what we're going to look to do is try to find buildings that are under county control, that we, at least if we come up with a date in June, we'll know we could be there, because currently we're beholden to the school boards. And obviously, rightfully so, they want to protect their teachers and their students. So our population is of varying ages, and a lot of them may be at a risk group where there could be a risk group in their school, and they don't want anybody in their district to be in danger. So that first instinct is just cut off everybody from the outside being in their school. So that's really the main problem that we have, and along with the other things, being prepared to work at home. We have a lot of old files, so a lot of that stuff is not something you could see paperless. So I think, planning out ahead and putting scanning as much old stuff that you need that's available when you do eventually go online is definitely something, more of a long-term goal. But you never know what you need until you're not in the office and you don't have it in front of you, and everything is not computerized as something.
Yeah, so it sounds like a big challenge on just trying to get testing done in the physical environment when you don't have any physical environments and you need to keep some sort of distance. Sheree, in Santa Clara, what's it look like on the ground there?
So we also have the testing issue because we have to stay 6 feet apart and what have you. We've reduced our testing capability from 120 per session down to 30. So we're just breaking up the groups in much smaller segments and still continuing with the testing as we can. We do tell candidates that if they're not able to come to the test, maybe the flights are not available or driving's too far or what have you, that we will reschedule them. But we're going to continue with creating that eligible list and getting it referred for departments, and we'll just add the people as we can. We did have telework in place for our staff. They were only limited to 1 day a week. We immediately pushed them out to you stay home and telework. For those HR assistants that were 100% in office, they already had laptops, but they didn't have the VPN access. So the county initially was trying to give VPN access, and it was crashing down because there were so many people online. So procurement was able to get us a thing called global product. And so now they just put it on the laptops, and there's no tokens or anything, and we've been running perfectly. All of our staff are at home, and the only reason they come in is to set up the test material and to collect the test material and score it. We've had issues with extra help running out. Our county only allows 1040 hours in a fiscal year, and so departments at this time of year are already maxing towards their extra help usage. So we are taking an alleged file to the board to allow people to continue working, because we need those janitors and nurses and that kind of thing to keep working. We've had an issue with delayed background check results. So what we've done is allowed departments to continue with the hiring process to get these people onboarded, with the caveat that if something comes back in their background check that has the job nexus, that they will be released immediately. One issue we also had was our retirees, because we're CalPERS, were restricted to sitting out 180 days and only being able to work 960 hours per fiscal year. CalPERS, we reached out and they waived all of that, so we can bring people back right away and we can keep them working. Our activation of the EOC is in full force, and so we're continually pulling our disaster service workers and redeploying them to where we need them. Our Santa Clara Convention Center is now kind of a mobile hospital, so they're trying to put lesser cases in that location so that the hospital itself can have functionality for people who really need a full hospital, because we have 3 hospitals in our county. What else?
Sherry, let me ask you this question. The amount of time you were working before the COVID-19 started to hit you guys till now, from an HR perspective, how much increase is your staff seen? Are they working an extra hour a week, 5 hours a week, 10 hours a week? Like, have you seen a significant increase? Not that they weren't probably working hard before, but has this had a significant impact on how many hours they're working?
It's interesting. The senior staff are definitely working much longer hours because we're responsible for staffing the EOC personnel unit. So we're rotating. It used to be like 3 of us, and we've expanded it to all of our senior teams. So we're trying to train people. We've actually trained our labor relations team and our benefits team. So they know not a lot about the HR stuff, but we needed more depth in our role in the EOC. And so we've trained them, and so we're rotating so that we're not constantly in the EOC. Our regular staff are still doing recruitment and classification work, but we also are going through our budget process right now. And because of the COVID-19, we've gone over our budget. We are allowing people who are non-essential, who don't have the ability to come to work, they're getting full pay leave. So we're actually thinking about creating a separate action reason in PeopleSoft so that we can track those people to show that they are willing to work, but they just can't because there's nothing for them to do. So they're all getting full pay, and so that's a lot of money there. So
is that because they
having
can't,
to,
Sheree, is that because they can't work from home? They just don't physically have the tools to work from home? I see. Yeah.
Yes.
What
So
percent
some
of
people, I mean, their job is 100% on the floor, and they can't, and not just in HR, around the county. So those people, even extra help, are getting full pay.
Right.
Are you seeing that in LA County as well, Pam and Roseanne?
We are not seeing that as much because we are deploying people into other positions. So if we have a person who can't work from home for whatever reason, they might be custodial, we're putting them on something else.
But let's do this too. Let's go to your biggest challenges and what you wish you would have known 2 weeks ago or 3 weeks ago, what you would have done different. Like, I'll sum that into one question for you, because I think they probably tie together. We'll start with you, Pam.
Our biggest challenge right now, I think, is just the fact that this is so fluid and that it's changing daily. You know, what we needed 2 days ago is not what we need today. So we've done the same thing. We're rehiring our retirees. If there's one piece of advice I would give people, it is shore up your retirees now, know what skill sets they have and where they're at if they're willing to come back. And then also take a really good look at all of your subcontracts for your augmented staffing services. Our biggest challenge is just that, again, we just don't know where the workforce is going to be at any given moment, because you don't know who might get sick or who a loved one at home, they might get sick and they have to take care of them. Or maybe the school's closed and the employee has no other options, needs to be home with children. So you just don't know at any time. It's very fluid that way. And that's our biggest challenge right now. I'm sure that over the coming months, we'll do a lot of critique and look back and see what went right, what went wrong. Right now, we're just in the day-to-day moving forward, just accepting change as it comes, which can be minute by minute.
Sounds like you would have, had you had the chance, really had a skill set understanding so that when you needed a resource to go to this area or that area, you could have got there faster. Yeah. Probably
Absolutely.
spent a lot of time trying to find people to do jobs where with 110,000 people, you probably had that skill set in there somewhere and just couldn't get your hands on it.
Yeah, absolutely. I think that that is a critical need that we'll have going forward in the future, is identifying where the staff are. We know what department they work in. We kind of know, we know if you work in a correctional facility, what your skill set is. But if we could, have more information about skill sets that we could apply. So particularly for those that might have any kind of skill sets around respiratory, for example. We know how many doctors we have, but it's or we know how many retiree docs we have or clinicians we have, but we didn't get down to the granular level of they were a respiratory therapist. So now we're scrambling to get all that information together.
Michael, how about you guys out there in King County? Sort of biggest challenges and things you wish you would have known 3 weeks ago that you would have done differently?
Yeah, I think for us, there's one, we're trying to figure out on the fly what to do with people who don't have work as easily available. So for people who can't telecommute as easily, what do we do to allow them to keep working? Because we're going to keep paying them. So what do we do with people who have a lack of work? On the flip side, what do we do with people who have too much work? So, our medical professionals and public health people are working 100-hour weeks. So how do we, protect them and build in some kind of sanity for them to combat these excessive work weeks they're doing? So how do we protect people who have to be in work? So without the PPE we need for medical professionals, how do we protect them? How do we get those kind of resources? How do we we've kind of shifted from some of the things we traditionally provide, like we're having a lot less people ride our buses. So we're shifting a lot of that work towards cleaning our buses. And so kind of how do we plan for the shift in our regular services? Because we kind of had to shift our priorities there from a traditional service of providing transportation to keeping things clean for people who still need to take transportation. So I think those are the big things. How do we deal with people who don't have work? How do we protect people who have too much work? And for the people who have to be in the office, how do we keep them safe?
Yeah. Michael, I think I heard in Nassau, really, from a testing perspective, it sounds like you would have tried to have plans in place to find different facilities. Anything else down there that you would have done differently?
Yeah, in terms of the facilities, definitely a facility that we control, such as the Nassau Community College, which we had kind of gotten away with, at least in that way, we could have more of a firm plan, and we would, if we have to postpone for a certain length of time, we want to go back in June, we know we can get it, as opposed to us being an outsider and somebody like a guest in somebody else's building, which kind of, as a guest, we can't force our way into the facility. So that's definitely the main thing. And what the gentleman was saying, Michael, I agree with the shifting work, the workflow, whereas certain work may come to a dead stop because maybe the school districts are closed and they're not hiring. That doesn't mean that you can't be, working in another area. And while I don't have control over what the county did, I think definitely more preparation that more people could work online at a moment's notice, because they were rushing around people were bringing their own laptops in on last Wednesday and trying to get VPN set up, and we had limited access to our IT staff because everyone was scrambling. So it was a scramble to get 8 or 10 people up as opposed to the whole department. So really, to have the plan in place that emergencies can happen, you may need the bulk of your workforce from home. Preparation for that, I think, is essential.
Mitzi, any sort of challenge? We heard a bunch of the challenges, but anything that you would have wish you would have known a few weeks ago that you would have done differently, or you would have put in place? Mitzi may have had a drop.
Jane,
Sheree,
I was going to say also, I think it's a really important time for, if you are facilitating your medical plans, ensure that they all have telemedicine at this time, as well as this is a really great time to have a strong EAP program and ensure that people know about it.
yeah, thanks. Sheree, how about yourself in Santa Clara?
The biggest thing that we're getting asked from our hospital team is analytics to understand people who were in a position before and had transferred. They want to know about those people so they can call them back to be what they used to be. So maybe I was a janitor before and I transferred to be an office specialist, and they want to know that so that they can pull them back in to be a janitor and redeploy them. So just having a database or some kind of access to understand the analytics to know what specific skills each person brings to the table and be able to deploy them as they should. Also in the EOC, we did implement public health nurses taking our temperature when we go in there, but it wasn't implemented soon enough. Somebody did come down with the COVID, and so I'm actually at home quarantined because I was exposed. So I'm on lockdown until the 28th.
You know, that's interesting. We had a question that's pertinent to this, and it says our biggest challenge is knowing the best practice for third-hand exposures where we have some in the community. What's the risk assessment and how do we handle that? What have you guys done with that, where you know of an employee who's been in contact with a person, maybe asymptomatic at the time? What's your policy for that?
It's interesting. Unless you have symptoms, they aren't having us not work. But because we're teleworking, for the most part, we're okay to keep doing it. It's just, you know, if you're going in and you start seeing something, you know, notify somebody immediately so that they can. Now the EOC, everybody's wearing masks as well.
It sounds like that even for our essential workforce, whether it's bus driver or obviously medical, who's in the middle of it every day, that if they've had contact with third parties, there isn't a policy in place that says you can't come in. They continue to work until they have symptoms. Is that what I'm hearing across the board?
That's kind of how we're doing it.
Yeah. We're really following the CDC and WHO guidelines. If we do have people who are exposed, we are sending them home under self-quarantine for 14 days, just to ensure that, you know, they wouldn't bring that into the workplace.
I think we're doing similar. Even our department director had just come back from Italy before things got crazy there, so he's been stuck at home for this whole time so far.
I had a question for King County. Are you paying employees who have been sent home or told to stay home even though they're not sick and they're sort of non-essential?
We are. That's
King
County executive decision. Mm-hmm.
And then
it's kind of being reevaluated on a pretty much a bi-weekly basis. We had originally sent people home through March 31st and now through April 24th. And that's kind of the agreed reassessment date.
Yeah. I'm looking at the questions now. If you guys have any other comments, please bring them. I'm trying to navigate the questions to see if I can't get something in here that.
Well, I think one of the things you had asked us to prepare for is like, what would we help people prepare? How would we help people prepare? Which we would have known 2 to 4 weeks ago. And just a couple of final thoughts from us. Like if you can relook at your telework policy, your telecommuting policy, and figure out how you can be more flexible in that, I'd recommend that. We had typically prohibited people from telecommuting, taking care of their kids, and being very specific about hours and where they're working. And we've kind of relaxed those restrictions during this time to let people try to, you know, because schools are closed, kids are at home, you have to take care of them, you can't leave your home, but we do want you to work. So kind of find ways you can get creative in your telecommuting policies. We're lucky to have kind of just recently put in a few communities of practice around recruiting and other things that we're able to meet regularly on and kind of innovate quickly. So we're talking, you know, weekly or bi-weekly with some of these groups, talking about how do we move to video interviews or whatever. And we're able to kind of innovate together, which has been great. And then the last thing I'd recommend is find a way to kind of empower your next in charges, because the people who are in charge, I've found, keep getting reassigned to other things, and that'll probably happen everywhere. And you don't want your business to shut down or things to stop getting done. So find a way to kind of empower those next people in charge to make the decisions they need to make without you being there.
I would agree with that, and I would also say, look at your policies and see what you can relax in times of emergency. So we used to require people to have training on telework before they teleworked. We've dropped that. We're dropping medical certifications, of course, right now. If you are sick, you are just to stay home. But look at all of those things that in an emergency you could wipe away to make it as efficient as possible.
The County of Santa Clara also did that, and we're putting in place a daycare for those who have to be at work, public health, hospital stuff. So then their kids will be taken care of while they're working.
Yeah. And how long into the process did you set that daycare piece up?
We're setting it up right now. We're literally trying to background the people that'll be with the kids, but yeah. So that's an
interesting takeaway. Yeah, you may want to start doing that now, backgrounding and facilities for daycare. Julie, you were going to say something?
Yeah. I think in LA County, we found that the minute our schools closed, all of those teachers were potential daycare workers for our first responders. So we engaged them immediately to say, hey, can you help in this? And that has helped to fulfill our need there.
Yeah, we ended up having a lot more staff working remotely than I think I had anticipated. I also envisioned that if we were remotely working, that it would be shorter term. So a lot of us had planned to take our laptops home like we do if we're going to be away from the office for a day or two. It's not going to be a day or two. It's not going to be a week or two. I know that a lot of us are wishing we had brought home more of our equipment. Some of us went into downtown Seattle. The buildings are no longer open to the public. Trying to get into some areas that we've always had access to that we don't anymore has been, there have been a lot of those kind of detail. If you're no longer physically in that space, if I had known, I would have, as silly as it sounds, I would have gone into a space and said, is there something else that I would want right now to be able to do my job as I normally do? And if I had taken that time, I would be better set up right now with this conversation because I'd be talking to you with a different monitor. I'm looking at a pretty small laptop screen, and we're all NEOGOV users. I really like my bigger monitors to work in NEOGOV. So anyway, that's just a little bit of it. And we had to respond very quickly to transition from some physical documents that we sent out to people that started and getting all of those into a soft copy format that we can share with people who haven't had access to that in the past that all of a sudden right now need to. So
it's hard to describe how fast it moves until you're in it, right? And then it moves so quickly. And you're right. We at NEOGOV did a test. We picked a day and said we want everybody to work from home to make sure all those issues that are issues with telecommunication are handled. And that was on a Wednesday. And then Thursday at 10 a.m., I was like, we're working from home permanently now, right? Because it just moves that fast. First, we just want to make sure, are we able to work from home? And then within hours, it was, no, we're going to go work from home. So it just moves very quickly. You're right. I think that's fair. There was a bunch of questions here around telecommuting policies. And can you share your leave donation policy? We might follow up and see if we can't post into the community some of the policies that are in place. I know there's some people that done some creative things around gifting of sick leave, vacation leave to other folks that we think was pretty impressive. And it's sort of, we saw it move very quickly inside our system. So we're going to try to get some of those out to the community as well. We may reach out to some of you guys to see if we can't get some of those policies. I'm getting a lot of feedback in the questions, with just feedback, not questions, of just how thankful people are that you guys took the time to get on the call today. A lot of great tips for them that are coming back. There was one sort of a very technical question. Do you know how you will be verifying I-9 IDs for new hires? Maybe a little too deep on that.
Yeah, I'd be happy to share a little bit more about that. We're looking at doing that remotely as well. And we're also looking at current legislation that would relax some of those requirements in this time. I'd be happy to give you information about the research we're doing on it.
Oh, that's great. That's helpful. And a lot of questions around interviewing right now. So I would say a takeaway for NEOGOV is we're going to put some video conferencing software into our product. It's funny enough, we've consistently talked to customers over time, and they've consistently said, "No, it's not a big deal because we do all that interview on site. Like, we like to bring people in, we like to interview them on site." It just hasn't ever been sort of a top priority, even when we would ask. But now clearly, you can see a scenario where it's required. But in the interim, what are you guys doing to video conference or interviewing remotely?
Yeah, we have a video interviewing tool that we've been using. I wish I could give you the name of it. I will. I'll let you know that. We've been using over the last year as kind of a test, as well as a remote proctoring, which would ideally allow lockdown a person's computer while they're taking an exam, so that there is no opportunity to, do something nefarious. And we've been testing that for about the last 6 months. Like both of them, they've both been great for us. So we have deployed them at a much greater rate now, and we're using them more widely. I'll be happy to give you the names of those and kind of how we implemented those.
Yeah,
thank you.
We've been using some of the, we've kind of had different things going on. We, as an organization, we use Skype, but as a result of kind of this recruiting community of practice we've found some people have had, other people have had success with Zoom, and again, I'd go back to having some kind of community of practice to kind of chat about what's working for you, because we're having to innovate day by day, and some Skype works great for most people. It doesn't work for everything, so those are the two we've been using, I think, primarily. But I think we're having to be a little bit more flexible in terms of what we allow right now.
And how are you guys determining essential versus non-essential staff? Like, who's making that call? And maybe Sheree, do you who's making that call there for Santa Clara?
So each department has to provide us with a list of all of their employees and whether they're essential or non-essential. And it doesn't mean that the function that they're doing isn't essential. It just means that they can work remotely to do that function. So we're using that in the EOC as well. We'll look at who's active and then compare it to the non-essential to be able to pull people in.
So really, it's around whether you can be remote or can't be remote. Is that how you're delineating that line?
Yes.
Is that the same for everybody else here as well?
We've been similarly letting lines of business make their own determinations on what's essential or non-essential. Departments make the determination on their own. We do have some guidance around what that looks like in our. We have a emergency all hazards manual that we use to help describe what that means. I don't have it in front of me, so I can't tell you exactly what the definitions are. But we do provide some guidance centrally on what we think that looks like. But we let departments make the ultimate decision on what's essential and non-essential.
As fast as the virus was moving, there was strong encouragement, though, that if a position could be done successfully remotely, that they wanted people to perform that work remotely.
Yeah. We do something similar. We have each department has a continuity of business where they look at all the essential functions that they need just to maintain their business. Outside of that, we see those as non-essential. Those are teleworkers now for the most part, unless you are deployed. What we're finding is more and more we're having to deploy our staff to work in the field.
Anybody with union issues, and how have you been working with the unions here? How's that playing? And we've had a bunch of questions around unions and the interaction there and what that looks like.
So the county has 24 unions, and We've worked with the unions to kind of relax some of the hiring requirements and transfer requirements and that kind of thing so that we can get to the people that we need to get to quickly.
I see.
Yeah, we have very large union contingents here in LA County, but we have found that the unions, particularly those that are directly supporting our first responders, have been working with us, and we've been very pleased. They've been helping us all along the way. It's been very collaborative.
I will tell you guys, this has been wonderful. I will again give you some feedback. I'm getting a lot of comments from people that are just very appreciative of you guys taking the time to get on the phone and have this conversation. Clearly, you guys are in the middle of it, and you're fighting the good fight every day. We really appreciate it that you came on. We like to be able to share the community. This is a perfect venue for that. So with that, I'll thank you once again. Much appreciated. Please be safe. If you've got any more tips, we'll probably reach out, and if you think anything else, let us know. And then also to the greater community at NEOGOV, send us anything that you think also makes sense. We'll get it in this document we're putting together, and then we'll publish that out to the greater community to see what some of these tips are. Some of them are fantastic, like just like take your monitor home. That's a good one, right? And then there's some much more in-depth ones around skill training and development and how do you reassign people. So really appreciate all of your guys' time today. I appreciate everybody who got on the attendees, and again, go forth and be healthy.
So
thanks.
that's
At some point. Thank you guys very much.
Thank you, Shane.
Thank you.